Well, I see some familiar faces. For those of you that don't know me, my name is Todd Cook. I'm an orthopedic spine surgeon here at Carolina Orthopaedics, and Lance Owens is the head of therapy here at ATI, and so he and I are going to do this kind of as a tag team. I'm going to kind of go into some introductory information about golf-related injuries. He's going to talk about the therapy side of things, how to stay flexible and strong for playing golf and to resist injuries in any sport, pickleball, anything like that. So we thought that this would be a timely talk, given hopefully that the weather is going to start turning and people are going to get back to the golf course. But as Julie said, we can kind of keep it casual. So I want anybody that has a question, you can stop me. Feel free to stop me. I can answer a question about golf-related stuff, other spine-related injuries for sports or otherwise. So the focus of the talk is around golf, and so we'll kind of stick with that to begin with, and wherever it takes us after that is fine. So, good?
Very good.
You guys, everybody hear me in the back? Okay. All right, so a little bit of history. Golf began in the 12th century in Scotland, and the USGA was later founded in 1894, established to govern U.S. amateur golfers. And then later the Association of Professional Golfers was first established in 1968, and then in 1970 the PGA and the PGA Tour were established. By definition, golf is considered a low-impact sport by the Surgeon General, but at the same time, it's also considered to be at moderate risk to cause injuries. So, and it has a lot to do with the biomechanics and what you're asking your body to do when you perform a golf swing, and we'll go into that in detail. But it does satisfy the Surgeon General's recommendations for regular leisure time activity, and the American College of Sports Medicine recognizes golf as an effective means to reduce risk factors for things like stroke or heart disease. Some of these numbers are a little older, but in 2007 there was an estimated 29.5 million golfers in the U.S., and by 2020 it should be almost double that. Males tend to represent a larger percentage of that, but I think that these numbers are from a study back in 2007, so 10 years later there's probably a much larger percentage that are women. I would argue that's probably closer to 60-40 at this point, as far as amateur golfers go. And 33% of golfers are over the age of 55. Again, the baby boomer population is aging, and so that number is probably actually skewed to a higher number now. The physical attributes of what makes people good golfers. So the elite players show a significantly greater hip, torso, and shoulder strength and flexibility, with flexibility being one of the biggest factors in my mind. Than less skilled golfers, and things like the power in your trunk, the power that you can generate through your hips, combined with your arm and grip strength, showed the strongest correlation to swing speed, and that was from a study back in 2009. This study done in 2007 showed that 1 out of 550 or so golfers will present to the emergency room with a golf-related injury at some point. A study out of Germany in 2003 showed that 60% of professional golfers and up to 40% of amateur golfers will have a golf-related injury each year. And most of these are either traumatic, so swinging straight into the ground, which can cause a lot of different injuries, or overuse, which tends to be the more common one, either going from not playing a lot, like in the winter, and then the weather changes and everybody gets out and hits as many balls as they can, and you end up with different types of tendonitis and little stress type injuries. Significantly more injuries in golfers who played 4 or more rounds a week or hit at least 200 balls a week. So you can gauge that by how many rounds and how many times you hit each week when you're in full swing. And And so there was a study that was kind of a landmark study as far as orthopedic injuries and golf related things. So in 2006, what they did is they separated into professional golfers, amateur golfers, and then subdivided it out into the mechanisms of injury and the sites that they had injured. So in general, the most common injuries for men were low back, their left wrist, and their left shoulder. And then women, it was their left wrist, low back, and their left hand. And usually in men and women, it tends to be the high volume, repetitive practice going from not playing a whole lot to I'm going to practice as much as I can because there's a tournament coming. Injuries in amateur golfers, they tend to be low back, which is the most common, wrist, elbow, and shoulder. In women, it tends to be their lead elbow. The most common mechanism usually is overuse, so going from 0 to 60 and when the season changes, and poor biomechanics. And this just kind of reiterates that. So this was out of that same study, and it shows that the most common injuries in professional golfers tend to be wrist and hand, and right after that is low back, and then the others fall off dramatically after that. Amateurs tends to be low back. I assume since you're here, most of the golfers in this room are amateurs, so that's why we're going to end up focusing a lot on low back because it all centers in the core, and when your core is strong and flexible, then you can resist back injuries or recover from them more quickly. Some of this is a little bit repetitive. The most common injuries that you'll see with wrist and hand, which tends to be, kind of that 13 to 20% of the injuries, are muscle strains. So on the extensor side, which brings your wrist back on your lead arm, ligament sprains, which tend to be either if you're hitting the ground or on follow through, you get hyperextension type injuries like this. You can get little fractures in the wrist, but most of it is, the most common mechanism is abrupt deceleration. So club head, full speed, hit a fat shot, hit long rough, and you torque your elbow or your wrist. Or general overuse, which tends to be the tendonitis. So you get tendonitis either on the outside of the elbow or the inside here. And that's all here on this slide. We're talking about the elbow. For the elbow, it's steep angle of approach or scooping or fat shots, okay? And if you have a worn grip, it can you tend to rotate your wrist, and it puts tension on the inside of the elbow, and so you'll get a strain injury to this tendon that attaches on the inside of the elbow right here. Shoulder injuries are not very common. The lead shoulder or the left shoulder for right-handed golfers is the most commonly injured joint. Most common mechanisms are either it has to do with the length of your backswing and a strong left-hand grip are the two most common sources there. Knee injuries are pretty rare. That has more to do with if you had a pre-existing issue in your knee. Tiger Woods was kind of the first one that really built in that high torque that puts a lot of tension on your knees and your low back. And so he's had a lot of issues with his low back, as we all know, and his knee. And his knee has always been about his meniscus. And so when you're planted and you come back and you really come through and get that high torque, you're essentially taking the femur and the tibia, which make up your knee, you're asking them to torque like this. And the meniscus is essentially a cartilage bumper in between those two bones, and it sees so much stress, and so that's the most common is seeing meniscus injuries. And and that doesn't necessarily mean it's an injury of the young golfer. So as we develop arthritis in our knees, you start to get degeneration of the joint line, and so you get fraying of the meniscus. And so it's not a meniscus tear that can be repaired, but it's still very painful because it gets frayed with a lot of rough edges. And so that's more common in the older population that golfs. So low back injuries. Low back injuries are the most common in both professional and amateurs. Up to 1/3 of the injuries that occur are related to the low back. And it results from the high range of motion and the forces that you end up putting on your low back when you perform a golf swing. And so that study from 2006 showed that it creates a compressive force in your low back at the level of the disc that's up to 8 times your body weight. So in amateurs, 80% more lateral bending and shearing and 50% more torque than professionals. And it all has to do with biomechanics, and that's what Lance is going to kind of get into of how to protect yourself. That's kind of saying the same thing. The biggest thing, this study in 2003 talked about flexibility and warm-up time, and we'll go through some of that. But there was a significant drop in low back injuries for golfers who warmed up for more than 10 minutes ahead of time. And you can kind of go into that a little bit of a routine to kind of get into before you hit the course. So I'll let Lance kind of go through all of that related to biomechanics and therapy.
So you can tell who the smart speaker is because his slides have lots of words and research, and I like books with lots of pictures. So there you go. So a couple of the things that we see a lot, and I'm going to talk a little bit about mechanics and setup, and posture is one of the first things that we look at from a therapy, rehab, training side, because that's the base. That's where it all starts. And if you start to build a house with a poor foundation that's out of line, then everything else is going to be out of alignment. It's going to be really hard to bring it back in. So we start with proper posture and a secondary spine angle. And you can kind of see this guy with all the lines. That's a pretty good posture for somebody. These are the most common faults right here, either a C curve, which is what we see mostly, particularly in folks in our age demographic, and the S curve is what you see with a lot of juniors. They've got too much flexibility and not enough strength. This guy's got maybe too much chest and arm and shoulder strength, but not enough flexibility to get up tall. David Ledbetter showing us the difference between good and bad, and Tom Watson showing us the difference between good and bad. So when we're looking at golf posture, we want you to be able to achieve that posture. This is obviously a poor posture. This is showing good posture. But the three things that we see, we want a normal posture, fairly straight through your spine, butt back, not curved here, because when you curve here, that actually limits how much rotation you can get. And so the golf swing is all about rotation. The more rotation you have and the faster you can rotate, the further you're going to be able to hit the ball. And so if you can't start out right, your body's going to make a lot of compensations. And the more compensations you have, the less likely you are to hit the ball solid and hit it straight. So posture is important. And from our standpoint, the reason a lot of folks have bad posture, the reason we see this posture a lot is flexibility. First of all, flexibility. And again, Dr. Cook talked a good bit about flexibility. That's usually the first thing that we look at in folks that's 35 or 40 and over. Typically, that's going to be their number one problem. So we hone in on that. In your junior golfers, and a lot of times in lady golfers, there's a strength issue. But in your golfers 40 and over, flexibility is the big one. And it's going to prevent you from being able to achieve this perfect setup and posture right off the bat. So some of the common swing mistakes that we link to physical problems within the body. So I don't teach a golf swing, but I figure out what in your body is limiting your golf swing. And so if you've got poor flexibility, you're going to have usually swing and posture compensations. If you can't get your shoulder here, your mind knows the club needs to be up here somewhere. But if you can't get it here, then you're going to get it here this way, or you're going to do something within the swing to try to get the club where your instructor has told you it needs to be and your mind has told you where it needs to be. Weak glutes. In golf training circles, the glute is king. That's a saying. Glutes are king, and that's your gluteus maximus. That needs to be strong, and that's kind of where you hear core muscles a lot, but the glutes are king, and we're going to talk about this a little bit. But if you've got weak glutes, you're going to push your hips forward, which is going to push the club forward, which is going to push your shot usually out to the right, or you're going to come over the top, and you're going to pull shots to the left. So you need strong hips, particularly the glute muscle. Weak hips, poor balance. One of the things that we work on a lot too is we check folks' balance, and sometimes I see people, and it absolutely amazes me. They can barely walk in here from a balance standpoint, but yet they go out and play golf. And how they hit a golf ball solid, I don't know. But it's amazing if you can just do some simple things to improve your balance, how much that's going to improve your stability over the ball, and it's going to help you keep you centered, and you'll hit the ball a lot more solid. So we work on that, and that usually begins with the core and the hip muscles. Weak core, no power. So the stronger you are, the more powerful you're going to be. And power is not just about strength, but it's strength and speed. Tight hips, that's going to cause you to sway. So again, golf is a rotational movement, and you need to be able to rotate and turn. And you turn mostly through your thoracic spine, your shoulder. They call it your shoulders, but it's actually your thoracic spine from here to here, and through your hips in here. And again, if you can't turn through your hips, then you're going to compensate either by sliding away or sliding through. And so working on flexibility through the hips, or if you don't have that, you're going to slide and sway. And then again, stiff thoracic spine, which is the thing I see most commonly with older golfers. And then you're going to get the arm swing. So if you can't turn your shoulders here, you're just going to do this. And so you can go out to the golf course, and you see that all day long. And that is a power sucker. It's almost impossible to hit the ball with any power through your arms. So again, things that issues in your body, flexibility and strength are going to cause. They're going to cause early extension and hip thrust, which is what this guy's doing. So his butt should be back here on this red line. But because he's weak back there, his hips thrust forward, causing him to either come over the top and hook the ball, or more likely push it out to the right. And that's the most common swing fault we see that's related to body issues. Reverse spine angle, again, that's a weakness issue. And then over the top. Sway and slide is usually the hip rotation. Reverse spine angle is weakness in the core, and over the top casting, again, is weakness, and it can be weakness and or tightness. I was fortunate back in about 1994. I became the medical director for I think it was the Nike tour then, but it was the web.com tour now, and they had a tournament up in Greenville, South Carolina, and I was able to work with Gary Player that week. He was one of our core sponsors up there, but he kind of worked me into the golf fitness thing, and I mean, he was the golf guru, and he would tell you that that age doesn't matter, and that had he not done what he did in his younger years, he would never have been able to keep up with the likes of Jack Nicklaus and Arnold Palmer and those guys, and it was all about fitness for him. And even today, he's in his late 70s. He's still unbelievable. He does like 1,000 push-ups, 1,000 sit-ups, squats, runs on a treadmill, elliptical. He does things that are unbelievable, but he kind of set me on a path to studying and learning more about golf fitness and nutrition and those kind of things. So I was fortunate to get to work with him up in just outside of Greenville, South Carolina, and study some of the things that he's done. And then that Tiger Woods, Dr. Cook mentioned Tiger Woods in 1994. A lot of golfers still didn't believe in the fitness mantra. But I'm going to tell you, when Tiger Woods came on the scene and did what he did through the first 10 years of his life, you better believe fitness went to a different level. And that was about the time I was kind of getting into it also. And it's just been amazing to watch the difference of how players look and play and do. And you watch some of the old films when guys are hitting, their longest drives at 250 yards now. That's a mid-iron, and they're hitting at 350. I think Dustin Johnson, I saw he was playing something overseas, and he was hitting it 380 yards. So it's amazing how it's come. And a lot of that's just fitness and taking better care of your body. But Gary Player still does that at almost 80 years old and still believes in it. So there's some exercises that you can do. One of the biggest problems we see is as we get older, because our eyes are in front, and most of the things when we manipulate our world, we do it in front of us, everything draws us forward. And over time, your mama was right. If you don't use it, you lose it. And a lot of us lose this ability to open up our chest, open up our thoracic spine, and get into this posture. This is kind of our natural, normal posture after a period of time. So that's usually one of the first things that we do to work on people just being able to get into this posture right here with your back relatively straight, and your hips back, knees bent just a little bit. Everything just in a nice, balanced, relaxed posture. So doing some exercises to stretch your chest, stretch your shoulders, and then, so that's what this guy's doing and this lady. And then doing some things to also strengthen those muscles, which is what the guy over here is doing, core muscles, stretching your hamstrings. I'm going to show you a bunch of exercises, but I've got a picture of I've got a handout that I can give you at the end that's got 8 simple little exercises, and it's going to hit all the major things that we talk about today: flexibility, rotation, strength, and all that. And if you do those 8 little simple exercises, even 3 times a week, I can promise you it's going to make a difference, and it'll be worth every penny you spent to come here tonight. So, yeah, somebody got that. Thanks. So anyway, the key is to improve your flexibility. Arnold Palmer said years ago that loss of flexibility is death to the golf swing. And the big guys, all the players now, they know. But this is Arnold Palmer. I like this picture. I mean, you can still see that even in his 70s, he had a really, really good, strong shoulder turn. And all that's attributable to him having good flexibility in his thoracic spine and his hips. All right, flexibility is key. It relaxes your muscles. You can get into these postures in a relaxed way. You don't have to feel like you're straining to hold that. It's going to increase your club head speed. Again, speed is strength and power. It allows for your shoulder and your pelvis separation. That's where you get a lot of power. The golf magazines call it the X factor, being able to separate your shoulders from your pelvis. That's where the pros really get their power, and it prevents that loss of posture as you're swinging, and it keeps your swing on plane. Again, if you lose that plane somehow because of flexibility or because of a compensation, it's almost impossible to get it back. So flexibility is the key to get all that stuff. So some flexibilities for exercise. I don't recommend doing this one with a cigar, but some people like that. They kind of look crazy, but there's some good exercises. These are good exercises. I threw a couple of these in that you can do at the course, but then others are good to do at home. So flexibility of your thoracic spine and your hips is a big key. I think I've said that. Have y'all? All right, got that. All right, so some other tools I just wanted to throw in that help improve flexibility. Things that we use here in rehab a lot. This foam roller, just rolling your muscles out. It's like a kind of a self-massage. I love doing that thing. I do it almost every morning at the gym. I roll on that, get my muscles nice and warmed up, and then I stretch. Another thing that we use here is a massage stick. I've got one of these stretching poles. You see a lot of pros use that thing. It's just some tools that help you to stretch more. Balls, yoga mats, and then yoga. When I worked with a lot of professionals up in Greenville years ago, again, one of those kind of aha moments for me was when I started incorporating yoga moves into what I was doing with my players. And some players didn't like it. Some players give me the same look you're giving me, like yoga. So then I just called it stretching and breathing. We're going to do some stretching and breathing today. But it made a world of difference with my body and in my game. And it can be simple stuff. And I know there's a lot of yoga places here on the Strand. So if you have an opportunity to try yoga, even if it's not specific for golf, yoga is a great way to improve flexibility, balance, and core strength. And so I'm a big believer in it. My wife and I still do it pretty regular. But it's another little thing that doesn't sound like it, and a lot of folks don't think, but it will absolutely change your golf swing in a positive way and give you power. But just loosening up those muscles in some way. All right, strengthening. Again, core is the king. Hips, core, strength. So doing exercises like the bridges, these exercises are on the form that I have. One of the simplest exercises people can do is just to stand up and sit down without using their arms. It's kind of a natural squat. And if you can just put your arms out or cross your arms on your body, sit down in a chair and stand back up. Do that 10, 15, 20 times, a couple of times a day. That hits pretty much all the major muscles from about your belly button down. And it's a super simple. I tell people all the time that have hip, back, leg, knee issues, what's one exercise I can do? And I usually say, do that exercise. It kind of hits them all. And then some of the back exercises and core exercises that I talked about. But again, you want to strengthen the core, strengthen your shoulders. Core number 1, shoulder blades number 2. A lot of guys want to strengthen their shoulders by pushing, bench press, the arm muscles, the one that looks good in the mirror. But they forget about the ones around their shoulder blades. And those are the muscles that hold you here. If you ever watch Rory McIlroy, some of those guys, when they turn around and walk away from you, their back is way more developed than their chest. Pros don't do bench press. They don't work their chest very much. They work their shoulder blades. They do a lot of pulling, a lot of this kind of exercise. they want strength up and back here. They don't want tightness here. They're strong, but they don't want anything to tighten the front of their shoulders. Most people that go to the Planet Fitness or some of the health clubs do the opposite. They want to work their chest and the muscles they can see in the mirror. So lastly, if you do these things, I can promise you they will help your golf game. Simple things, and like I say, I've got a little handout for you, but if for whatever reason you're kind of stuck or you're having some problems or you're having pain or you need to see doc or whatever, and he sends you over to us, one of the things that we do for golfers is we do it's a TPI, that's Titleist Performance Institute, and I'm certified through that, and we do an 11-point screen where we're looking at you from head to toe. So you may just have back pain. That's the number one injury that we see and hear about. But we want to know what's causing that back pain. Is it tightness in your hips? Is it tightness in your shoulders? Is it weakness in your lower back? Is it weakness in your legs, calves, whatever it is? This 11-point screen helps us kind of tease that out and figure out where that problem's coming from, and then give you exercises or things that you can do that's going to specifically help whatever your issue is that's either affecting your golf game or your pickleball game or playing in the backyard with your grandkids. So that's kind of what we do. We try to figure out the underlying root cause and then give you tools that help you to eliminate that. So anyway, that's what I got. So now we're back to the smart speaker.
Thank you, Lance. I was going to go back to some of the basics that I've done in the talks before, because it helps to answer a lot of questions that some of you end up having either right at the end or after the talk. So the discs are essentially shock absorbers in between the vertebra and your spine. And they have a very kind of softer center. It's called the nucleus pulposus, and it's kind of this kind of cartilage consistency. The outside, the annulus fibrosus, is essentially layer upon layer of fibers that when you cut them and look at them under a microscope, kind of like layers of burlap. And over time, as we age and do things that are not so smart or just living our lives picking things up, you get little injuries. And what can happen is you can get little tears in the outside of it. You can have disc injuries throughout your life. We're all going to get them eventually. And what you're asking your back to do when you perform a golf swing is there's a lot of torsional and shear stresses put on the disc. And it can lead to a disc herniation. So aside from back pain from arthritis and degeneration in golfers, the most common is going to be a disc herniation in your low back. And what can happen is you can have a disc herniation, which is where some of the inner portion, that nucleus, leaves the normal confines. And when it does that, you can see, well, the spinal cord, this is up higher, so in our low back, the spinal cord ends higher. So down in your low back, it's mostly individual nerves. But it can push back and push on an individual nerve, depending on where that nerve exits and goes. A lot of it's down at the base of our low back, so that's going to be the nerves that contribute to your sciatic nerve. So your sciatic nerve begins in your buttock, and so you can have bone spur, you can have a disc bulging, or a full-blown disc herniation that pushes on one of the individual nerves, and it can create all different types of pain, numbness, or even weakness in your leg. In general, you can treat it without any type of surgery. So in the beginning, anytime, most of you know this, anytime you injure yourself and you have an acute back sprain or strain from golf or whatever it is, you want to start with rest, stop doing the things that you know probably caused it, which means stop playing golf for a little while. Rest it, ice it. Combination of ice and heat, usually alternating between the two, will help. Medications that are over the counter like naproxen and ibuprofen work as anti-inflammatories. There's a lot of people that can't take those medicines because of different medical conditions or medicines that you take. And so there's topical forms of those things that we can prescribe as well. I included this picture, but he was mentioning the core a lot. The muscles in your core that make the biggest difference are what's called the transversus abdominis, which is part of your abdominal muscles that run side to side that you can strengthen by laying on your back, small weights in your hand, and holding over to one side and rotating like that. The multifidus is part of the spinal muscles, and all of those core stabilization exercises that he's talking about. I really like the exercises where you're on all fours and you extend one arm and one leg and hold it, because that keeps your spine in a straight line, and so you're not asking the discs and the joints to move and hold in a funny position. You know, there's a lot of different flavors of yoga, right? So I would suggest from a yoga, and I love yoga too. I try to do it as much as I can. I'll admit it. But you could probably, most of you that are internet savvy, could get on YouTube or Google and look up 30-minute yoga video that's back friendly or back safe yoga. And it tends to be things where you're not doing a lot of flexion, extension, side twisting and bending. It's called isometrics, where your muscles are contracting, but your spine is staying relatively straight. Like I said, 90% of the conditions that I see in the back that are related to golf or otherwise can be treated without surgery. It depends on the degree of your symptoms. So I see some people that come in and say, you know, I'm not playing very well, my back hurts, versus I've been on the floor at home for 2 days. You know, it depends on how you initially present and what we find if we end up doing imaging. So sometimes I end up having to get an MRI. That helps me look at the discs, the nerves, and the soft tissues, so I can get a sense for what's really causing your problem. But the imaging doesn't dictate what we do. It's just a piece of the puzzle that gives me more information. The urgent need for any type of surgery is very rare. So, golf and low back pain and older golfers. So many golfers continue to play as they age, obviously, and may develop other conditions like spinal stenosis or what's called a degenerative spondylolisthesis, and I'll show you some pictures of that. And those can make it hard to walk just in general, particularly on a golf course. The walking long distances can be very difficult, but it could mean just you're having a hard time getting around the grocery store where you physically can't walk without the cart. You need to lean forward, which tends to put you in a position that opens up the space for the nerves. And that's why a lot of people end up doing better with those type conditions when they can lean forward. When they sit, they're fine, but the more they stand erect and walk, it puts pressure on the nerves and the legs start to ache. Spinal stenosis is either congenital, which is less common, versus acquired, which is degenerative. So there's a lot of terms that get thrown around that some people don't quite understand. So degenerative disc disease, arthritis, spinal stenosis, they're all kind of part of the same processes. So we're all going to, as you said, start to do this. And mostly it's because we lose the height of the discs in our spine. And so in our mid-back, we already tend to have a little forward curvature, but as those discs, which are in the front of the spine, get shorter, so do we. In the low back, the same thing. We tend to have an arch in our back, which is called lordosis when we're younger, and as the discs lose their height as part of the natural aging process, because they lose their water content, essentially, we start to pitch forward. So that's, as we age, the natural tendency is to do this, and so the exercises that Lance and I were talking about are to fight it. We're essentially trying to fight the natural process of what your spine is going to do. Spinal stenosis is a part of spinal degeneration or aging. So you can see in that top right picture, the disc, this is a section of you cut like this. So the disc is in the front of the spine. The joints, which are kind of towards the, I wish I had a pointer, or I wish I was taller. The central portion that they have circled essentially should be wide open and more white, suggesting that it's wide open and plenty of room for the spinal fluid. And so you can get generalized disc bulging that pushes back towards the nerves, and then there's two joints in the back of the spine that get bone spurs on them, and the ligaments around them get thick, and just like your hip or your knee will, but it crowds out the space for the nerves. And that's what spinal stenosis is essentially. It's loss of space for the nerves as part of the natural aging process. Now, some people are born with less space to begin with, so it doesn't take much. Others have plenty of room, and so they can tolerate a lot more arthritis or degeneration in their spine. A spondylolisthesis is a slippage of the bone, so you can see down at the very bottom, I think I'm tall enough for that one, right here. So the vertebra are these blocks of bone, and they should be lined up as the rest of them above, but here you can see it slip forward. And that is also because of spine degeneration and arthritis in the joints. You get excess motion in the joints in the back of the spine, which allows them to slip upon one another. That also causes stenosis or tightness around the nerves. All the nerves that exit down there in your low back come together to form your sciatic nerves, give you movement and feeling from here down, and can cause all different types of problems: numbness, tingling, weakness, and pain. So this is a good schematic because it kind of shows you, as you go down the spine, the things that happen. At the very top is a normal disc. As they degenerate, they lose their height. You can see that second disc down has got tears in the outside of it, and so that's that annulus, the outer part that I told you can tear. You can have people will come in and they ask me about their MRI. I have disc bulging. I have 5 discs that are bulging. Well, a disc bulge is just essentially as the disc kind of starts to collapse, the outer portion will pooch back towards the nerves. That's what a disc bulge is. And so just because you have disc bulges doesn't necessarily mean it's a bad thing. It just means that it's a natural process, okay? When you get a full-blown disc herniation where you see that big blue piece, that's where a piece of the inner part has lost, it's left the confines of the disc, and it can push on nerves and cause pain. And then at the very bottom, you can see advanced disc degeneration, complete loss of the disc height, big bone spurs that start to form around it. And essentially, that's what happens at end-stage spine arthritis. The spine is essentially fusing itself at that point. When it comes to different types of surgeries that can be done, if it gets to that point, I can do some minimally invasive procedures, some of which I can do downstairs as an outpatient at the Carolina Surgery Center, but otherwise we would do at the hospital. And some of them I can do through pretty small incisions, through essentially a metallic tube with a microscope. Others, a more traditional, a little bit larger incision, but still can be done as an outpatient. For those, in general, if I can do it less invasively or even minimally invasively, usually I'm getting people back to swinging a club, kind of half-speed chip and putt at about 6 to 12 weeks. It depends on how extensive the surgery is and things like that and how you're recovering. But most people after that kind of surgery are full speed at 3 months. A fusion surgery is kind of the end game. If it gets to the point where we've either exhausted other options, already done one of the minimally invasive type procedures, and we get to the point where there's instability in the spine, kind of like that slipped spondylolisthesis we saw, then we move towards talking about fusion surgeries. A fusion in the spine is essentially using bone graft and usually some type of metal implant to stabilize a level that is fully degenerated and is causing so much pain that we have to move forward with it. And there's different ways to approach it. I can do them through small incisions in the front, side, or the abdomen, through the back, and in different ways and methods that we have of replacing the disc. So the last few slides are kind of our general tips to keep you on the course. Warming up. So I told you about that study that said that if you warm up for 10 minutes before you play golf, it will, your swing, your club a few times, you gradually increase your range of motion. You want to start slow. Don't go from 0 to 60. So as the weather starts to warm up, don't hit 200 balls right off the bat, because we already know that 200 ball mark is the one that puts you at risk for injury. Strengthen your muscles. So he's going to give you the sheet that talks about the strengthening exercises, but more so focusing on flexibility. As we age, we tend to be arm golfers because you don't have any of that flexibility. So you've seen plenty of people it's all in the arms. You lose power, and if you can be more flexible, then your swing will improve. You want to build up your endurance, regular aerobic activity, like walking and bicycling and swimming. There's a couple places in town where you can do aerobic exercise in the pool. They actually have aquatherapy, which is excellent. Essentially removes gravity and fights the arthritis that way. Be careful when you lift your clubs, obviously. Just like anything else that's heavy, and they tend to be pretty heavy, you want to not lean forward. So it's all in the legs, straight back, lifting with your legs as much as you can. And then obviously trying to hit objects other than the ball. and we'll open it up for any questions related to golf or otherwise.